This is Darian Patterson from Indiana State Department of Health. We're here to present blood pressure management using EHR data to assist in patient blood pressure control. I have here
Nicole Hall from Valley Professional Community Health Center. And with me I have Lauren Doublecourt, CMA, and Tanya Dahl, LPN, also the referral coordinator.
We're moving to the next slide. To give you an overview of our presentation, we're going to talk about the importance of high blood pressure, uncontrolled high blood pressure, using EHRs and detecting patients with high blood pressure and those who are uncontrolled, getting those under control with the EHR and data, and other ways to use EHR data to control with lifestyle changes and self-management goals, team-based care, medication adherence, and self-monitoring. To get started, high blood pressure, also known as silent killer, has no warning or signs and symptoms. Many people who have high blood pressure should get their blood pressure checked by their physician. High blood pressure can lead to heart disease, stroke, and kidney failure. So each patient, when entering a doctor's office, should have their blood pressure taken. If they're diagnosed with high blood pressure, they should be educated about controlling their blood pressure. Going to the physician's office periodically to have their blood pressure taken is one example of controlling blood pressure. As we all know, high blood pressure can put you at risk, again, for heart disease and stroke, which are the leading causes of death in the United States. In addition, having high blood pressure is also a major risk factor for kidney disease. High blood pressure affects people of all ages, ethnicities, and so everyone needs screening at all times. To give you some facts, in Indiana, heart disease, cancer, and stroke represent the top three pillars for Hoosiers, and high blood pressure touches every aspect of these disease processes. In 2011, for Indiana, 33% of adults reported having high blood pressure, both controlled and uncontrolled, and nearly 80% said they take their medication. According to the CDC, and this is national figures, 67 million American adults, which is about 31% of the population, have high blood pressure. That is nearly 1/3 of all American adults have high blood pressure, and many have uncontrolled high blood pressure, and out of that, many people do not know that they have it. So remember, I told you in the previous slide, 67 million Americans have high blood pressure. Approximately 36 million have uncontrolled hypertension. In addition, million Americans are reporting to take their medication. However, it's still not under control. Again, according to the CDC, high blood pressure contributes to 1,000 deaths per day. In 2011, 69% of people who had their first heart attack, 77% of people who had their first stroke, and 74% of people that were diagnosed with chronic heart failure had high blood pressure. Uncontrolled high blood pressure. From a cost standpoint, high blood pressure costs the nation $47.5 billion annually in direct medical expenses and $35.5 billion each year in low productivity. So, in terms of costing, those adults who have high blood pressure, 89.4% reported having a usual source of health care. 85.2% reported having health insurance. 87.7% receiving medical care in the previous year. So we need to continue to follow up with those patients in terms of their high blood pressure. So this is a good target audience to refine interventions to improve high blood pressure control. The folks here at Valley Professional has really done a good job in helping control high blood pressure using EHR. I'm going to turn it over to Nicole, where she can talk to you about what they've done at Valley Professional.
Hi, I'm Nicole Hall, I'm a nurse practitioner at Valley Professional Community Health Center. I'm going to give you just a little overview of what we're going to talk about today. Okay, so we're going to just talk about recording blood pressure in the EHR, the GNC7 guidelines, detecting uncontrolled hypertension patients, tracking that data, using the EHR to develop a plan, some self-management goals, barriers to tracking clinical measures, setting protocols and policies to maintain solutions, and consistency in team-based care, and then some resources that we've kind of come up with that are available for patients. So recording blood pressure. We record blood pressure on all patients 3 and above, and you have to do this for something called patient-centered medical home, which is what the PCMH stands for. We do this during vitals. It's a sitting blood pressure typically done by the CMA LPN. It is a good idea to have a repeat blood pressure field, and I will show you that in just a minute, for those patients who typically have white coat syndrome or anxious as they come into the office. We also document in the problem list if they have hypertension. It's important that it's readily available there for us. It's on a summary page, which is right there on the first page of the office visit. And we'll show you that on the next slide. So as you can see, I've circled in red where we've got the blood pressure on our EMR or each EHR. We also have that repeat blood pressure field, which is very important, especially for those who you might have given some type of intervention to clonidine or relaxation or something like that. Very important, and we'll talk about that here in a little bit. And then also down on the problem list, as you can see down there, I've got that circled as well. It'll pop up and you can scroll through that. And we use Centricity. I'm not sure what everybody else is going to use, but it's ideal to have them right there readily available for you. So in looking at hypertension, we use, as I'm sure most of you do as well, the JNC7 guidelines for hypertension. Our nurses know these standards, they know these guidelines, they know when to come get us if they have a patient whose blood pressure is above 140 over 90. We also use the stage 1 hypertension for pulling data that I'll show you later that we graph on a monthly basis. Okay, so it's great if we have a patient with hypertension who follows up and does everything that they are prescribed and they are in good control. But what do we do about those who have uncontrolled hypertension, and how do we keep track of them? Well, within our EMR, we have some things set up that can kind of help us recognize if they're not coming to their appointment. So one, we have a no-show appointment. So say you have someone who comes in with hypertension and you say, I'd like you to come back for a follow-up nurse visit or a follow-up physician or provider visit. If that's scheduled right then and there and they do not show, the front office will send us a notification letting us know that that patient did not show up. It gives us prime opportunity to have someone call, find out what's going on, if we can help get them to the office or whatnot. We also have, for those who do come in for nurse visits, within the EHR, we have a nurse visit flow sheet that they will repeat their blood pressure and it'll be sent to us for signature. Or if they are still out of range, we can possibly see them that morning and do an adjustment or make them an appointment. Within the EHR, we can also see how consistently they are filling their meds. So if you've got someone who you're seeing for a hangnail and they've got high blood pressure, you can kind of look back and say, well, he's not been on your medication because he's not been filling it. We also use the refill notices that we get, some that are electronic from the pharmacy, as well as phone calls to go back and see it as a reminder for us to see if they're due for a chronic visit. Typically, we have a report run 4 times a year and to identify those with hypertension to make sure that they've been seen within the last 6 months. Okay, so what does it look like when patients are out of control? You can see on the first graph there on the left, we've got, these are the providers in which I work with, and our goal is 85%. We'd like everyone who's got hypertension, that 85% of those patients be within good therapeutic blood pressure. Of course, that doesn't always happen. And we'll talk about a little bit more about that in a little bit. But for meaningful use in patient-centered medical homes, we track this monthly. And if you look at the one on the graph on the right, this is just our patients who have a hypertension diagnosis. Are they on medication to lower blood pressure? Okay, so kind of referring back to that graph on the left, what will, okay, sorry, I was out of line there. Okay, so what do we do with those? How do we develop a plan to meet the needs of those with uncontrolled hypertension? Well, again, we utilize the EHR to track those who need to be seen, and we like to see them every 6 months. We send a reminder letter out reminding them, hey, you are due for a chronic visit. We review their medication history. It kind of helps guide future treatment, lets us know what they've been on, what works, what doesn't work. It also gives us an idea of, medication interactions and things of that nature. We can customize individual goal plans within the EHR. And we're in the process of doing this right now. We are trying to get a form within the EHR that helps give them a goal. And this is what your blood pressure is today. Our goal is to adhere to medication. These are the things that we're going to do to try to get you within goal. And then also within the EHR, we can use handouts, and it will show up that we've printed these out and given them to the patient. All right, and so for those who need a little extra help, often we've got a resource that's great through ISU Nursing Community Health students who come in and do provide some one-on-one education with our patients. So for those who think that really don't understand the disease process or need some help with the DASH diet or understanding exercise, we bring them in. We pull a list of those with high blood pressure, have hypertension diagnosis, as well as their last blood pressure was out of goal. And we have the students call and just kind of go over some things with them. Would you like some additional resources? Are you having trouble getting your medication? Do you understand what hypertension is and what it does to you? So that's a great resource that we have through the ISU nursing students. Okay, so are these people going to show up on your tracking? Absolutely they are. So when you're kind of dealing with blood pressure and it's before you've actually made the diagnosis, we oftentimes will use elevated blood pressure as a diagnosis, so it doesn't quite count against us in the beginning. Once we've established that on the second visit that they do have hypertension and we put it in there as a diagnosis, then that patient will start counting in your tracking. So note that in the beginning, if you're not quite sure, don't automatically tag them with a hypertension diagnosis because it will count against you on your measures. If you're trying to control their blood pressure, yes, that they will show up on your monthly report. It will show that your numbers will be lower. And because of this, we try to do our follow-ups within 2 weeks. We try to get them in for a nurse visit and to see if they're in control, and we follow them up within 2 weeks. And it's important when you're setting up that you're tracking to pull from the last reported blood pressure, and that can be found in both a nurse visit or the repeat blood pressure field. That was something we learned along the way. Our blood pressure management was really low, and we figured out because when we were repeating their blood pressure, it wasn't going into a field that was you were able to capture. All right, so this is kind of for your staff, some policies and protocols that we use. We identify those with high blood pressure to the provider during intake, and especially if they're out of range. That gives us the opportunity to maybe do an intervention, relaxation, clonidine, something of that nature to help bring them down so that then after 5 minutes, or if it's a medication, after 20 to 30 minutes, we can repeat the blood pressure if it's elevated. Note that waiting times on providers can raise people's blood pressure, and we've seen that definitely. Also for those who have white coat syndrome. We document the blood pressure reading every time in the EHR for every visit for all patients 3 and above. We ensure that the diagnosis that's in the chart is the correct one that we will pull from to do our tracking. And then just a note that it is the responsibility of all team members to make sure that we are following these patients. It goes from the front office to see when they're calling in for refills, are they due for visit, to the nurses, accurately taking blood pressures and identifying those who might need an intervention, to those of us who are the providers who, will follow them through and try to get them that goal. So some resources that we use out of our EHR to notify us is, number one, we have prescription assistance, and when we've utilized the $4 list and we're unable to get them in goal, we can get some prescription assistance. What's nice about that is we have tracking capability. We send notes to our prescription assistance person. They will then send notes back with us to say that all the paperwork's been filled out, and then they also give us they send a note through the EHR telling us that the patient did follow through and they did pick up the medication. We also utilize reduced fee drug lists, which is kind of nice, like the $4 list, GoodRx, and things like that we often document within the chart where we're pulling from and trying to get them the medications that are the most economical for them. And then the other part of the EMR that I like is being able to go back through and readily look at the history and look at what have they been on, look at what they're currently on now, and if there's any drug-drug interactions for safer prescribing. And this can be set, the drug-drug interactions can be set within your EHR for different sensitivity levels. Okay, that's all I have.
As you can see here, we have other blood pressure resources, Million Heart Initiative. You can find that on the CDC website. CDC website itself, cardiovascular disease and blood pressure resources for professionals. The National Healthy Lungs and Blood Institute, and it shows the JNC7 and other resources, as well as the American Heart Association high blood pressure material. You can find those on their website as well.
If you do have questions, you can contact Darian or Nicole through the information that's on the screen now.